Good evening and welcome to Pandemic Perspectives. My name is Amy Finley and I'm the Dean of Students at the University of Michigan-Dearborn. I can't believe that tonight is our last night together. I am so pleased that you're here to celebrate with us as we complete our final installment of our exciting 6-part series, which has been led by faculty from a variety of academic disciplines across the institution. Throughout the 6 weeks, we've explored the impact of race on the care, the example of the pandemic in London in the 1800s. We've learned about the virus from the perspective of epidemiology, and we've explored the impacts of COVID-19 on older adults and also in transition to adulthood. As always, please feel free to go to our Pandemic Perspectives website so you can catch up on anything that you missed. Now, in our final week, I know that you all already know the drill, but I'm just going to remind you that at the end of tonight's presentation, we will have a question and answer portion. You are welcome to use the Q&A button at the bottom of your screen in order to ask your questions, and you may submit them at any time throughout the presentation. I'd now like to introduce you to our final presenters. Dr. Natalie Sampson is our first presenter. She examines the public health implications of land use and infrastructure. She conducts research with community partners to identify and address structural inequalities in environmental decision and policymaking using diverse qualitative and quantitative methods, including concept mapping, photo voice, and health impact assessment. Dr. Sampson is the chair-elect of the American Public Health Association's environmental section. In 2019, she was the recipient of the Carol Hollinshead Inspire Award for Excellence in Promoting Equity and Social Change from the University of Michigan CEW+. At the University of Michigan-Dearborn, Dr. Sampson teaches courses in environmental health and community organizing. She also co-founded the Environmental Health Research to Action Youth Academy with community and academic partners to build intergenerational capacity in community science and policy advocacy to address environment racism. Our second presenter tonight is Justin Onwenu. Justin is a 4th-generation Detroiter and environmental justice organizer for the Sierra Club. As a Detroit-based organizer, he fights for clean air, clean and affordable water, and a just economy for all communities. This has included advocating for city ordinances that protect drinking water, securing funds for communities in need of air filtration systems, and building broad-based coalitions. He currently serves as the youngest member of the inaugural Michigan Advisory Council on Environmental Justice under the direction of Governor Gretchen Whitmer, and was also recently appointed to the Democratic National Committee's Environment and Climate Crisis Council Platform Committee, where he was one of 12 nationwide members responsible for helping develop recommendations for the climate, environment, and energy planks of the 2020 Democratic Party platform. He has published opinion pieces for the New York Times, The Hill, The Guardian, and the Detroit News on a variety of social justice topics. And now I'd like to invite our presenters to provide us with their presentation.
Hi, everyone. I'm going to kick us off here and just really thank you all for taking time to either be here this evening or watch this recording on your own time. We are going to be talking about environmental justice today, but we're also going to be talking about COVID-19, which is the theme of this series. Before we get started, I just want to acknowledge that University of Michigan-Dearborn sits on the territory of the Three Fires Confederacy of First Nations. So Amy already did some intros for us, but there you can see our faces. I'm just really honored to be able to speak tonight with Justin. As you heard his bio, he really is a force, and I think you'll learn a lot from him in this next hour and a half we have together. So it might seem a little dry, but we thought since everybody's coming to this series from different perspectives, it's not a class on one theme or topic, and COVID is threading through all of it, that we'd start with some definitions. So for those who aren't familiar with the concept of environmental justice, you can read the definition here. This is straight from the EPA. So after decades of mobilization from community activists, Executive Order 12898 in the EPA established some work to respond to those calls to action that community leaders and environmental justice advocates had been calling for a long time. And so this idea that environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to development, implementation, and enforcement of environmental laws. So both the process and the outcomes need to reflect justice and need to be equitable. The flip side of that that is important to think about is when we don't have justice, what is perpetuating the system? And so sort of the godfather of environmental justice, Robert Bullard, talks about whether this is by conscious design or institutional neglect, we can see disproportionate impacts, particularly for communities of color. So we don't have a lot of time to get into it, but I'd really encourage folks to go and read the work of Robert Bullard, Dr. Beverly Wright, and many other leaders who've been really launching this out of the civil rights movement for several decades to really make sure that the burden of environmental issues does not fall on Indigenous, Black, Brown communities, and so in low-income communities. And so really thinking about what does that mean? And so there's an example of a historic moment from 1982 when 6,000 trucks of toxic PCB waste were brought into Warren County, North Carolina. And it's one moment in history of the environmental justice movement. So we're also talking about public health. If you've participated in this series, there was some history of epidemiology presented and thinking about kind of the patterns of COVID. And as someone who has degrees in public health and studies public health, we've spent a long time talking to people about what this field means, but I think in this current moment, in a current moment of a pandemic, that it's become common conversation in households and in communities to be talking about how do we prevent disease, how do we prolong life, how do we promote health. So not just making sure people aren't sick, but also making sure people can thrive, which is a real struggle right now as we're starting to look at patterns of COVID and outcomes for different communities. And so another concept that really intricately links to this idea of environmental justice that the field of public health uses this phrase is social determinants of health. So when we think about health and well-being, we're often touting, exercise and eat well, but it's much more than our behaviors. And so this concept of social determinants of health is really simple, actually. It's stating that we need access to transportation, access to healthcare, access to employment, access to education, right? All of these things. Healthy housing opportunities in safe places. We can't go exercise and eat right if we don't have access to these things. And so, not just physical access, but is it affordable? And is it a place that I go to regularly in my community? And in kind of thinking about how this comes full circle, right? If you don't have some of these things in place in your community, then that affects your health, that affects your quality of life, which in turn then makes it hard for you to be successful in school, or you might miss work, right? So social determinants of health is really central to addressing health inequities. And so this concept is really important in thinking about COVID. So I'm going to hand it off to Justin now and let him take the next few slides.
Well, thank you. And again, I'm really excited to be here with you, especially as someone who is really rooted in community and someone who's using research to create change. So thanks again for having me. And I do want to start off piggybacking on what was said, which is that we're really dealing with systems, structural racism, systems of inequality. And, the Flint water crisis is an ongoing crisis that has put environmental justice in a lot of ways on the map. It's in a lot of ways, in bad ways, put Michigan on the map. And I think that it provides a good case study in what systems and systematic racism looks like. I think the quote from Dr. Atisha sums it up, which is that, we're dealing with, injustice that's amplified by history of racial discrimination, especially in regards to housing practices. I actually got into environmental justice work. I was originally interested in public health and medicine, ended up deciding to get into environmental justice work after a hurricane that hit. The hurricane exposed me and opened my eyes to a lot of the injustice that people were experiencing. I met families who a year after the storm still had blue tarps on their roof, and those tarps are supposed to be temporary for a couple of months, and you remove it after you get the damage assessed and addressed. I met families who had to move their children out of bedrooms because mold had overtaken the bedroom. And so for me, that was a life-changing event. And I realized that these sorts of events, these sorts of long-term effects weren't seen in every neighborhood. And actually, whether you look at Houston, where I was at the time, Detroit, Chicago, which is the map you see to the left, every single city in one way or another has a history with redlining, with exclusionary housing policies. And this policy is compounded into the environmental injustice that we see today. Where you live can determine whether you live next to a toxic site or not. It determines when it comes to zoning policies. If you have industrial use facilities that are zoned right next to residential zone areas, it determines whether your schools are next to those industrial use facilities as well. And so in every single city, you have maps that are still linked to what we see today, where Black and brown and low-income communities are located in sites that flood a lot, that don't have great infrastructure, that are right next to toxic sites. And that explains a lot of the injustice when it comes to environmental injustice that we see today. I also want to mention this specific to Michigan is our history with emergency management. So emergency management laws, whether it be Flint, Benton Harbor, the city of Detroit, have been used in a way that has disproportionately harmed Black and brown communities and political power. And that's resulted in a lot of ways in privatization, regionalization of public utilities, public sources of wealth. And that's one of the root causes of the Flint water crisis that I want to point out. It was cost-cutting measures. It was emergency management laws that took away democracy from Flint residents and Detroit residents, that allowed CPA essentially to decide what gets funded and what does not. So I do want to just mention that we're really dealing with systems. We're dealing with a lot of history that needs to be talked about as well. And if you could go to the next slide for me. So I do want to provide a couple of cases of local examples of environmental injustice just to provide helpful context for folks. I mentioned hazardous waste as something that folks who are living in formerly red line areas are disproportionately exposed to. Today in the state of Michigan, despite making up only 25% of the population, 65% of those living next to hazardous waste facilities are people of color. And these hazardous waste facilities process mercury, cyanide, arsenic, PFAS, which has been in the news a lot lately, and a slew of other harmful chemicals. And not only is there a disproportionate exposure, but over 70% of this waste comes from outside of the state of Michigan. It's only 5% of the waste that are located in these neighborhoods that are actually coming from those neighborhoods. So you have disproportionately minority communities that are exposed to hazardous waste coming from communities that are not their own, and they're having to contend with the health effects of facilities like US Ecology, which is what you see here. In January, the state authorized this US Ecology hazardous waste plant to increase their storage and processing capacity by nearly 10 times their limit, to now what they're able to process is about 677,000 gallons per day. And again, this facility is located predominantly in a Black neighborhood and also right next to a historic home for immigrants from all over the world, Hamtramck, Michigan. It sits less than 2 miles from another hazardous waste facility that is also permitted by the state to process thousands of tons of toxic chemicals per day. And again, a father of environmental justice, Dr. Bullard, said, whether it's by conscious design or just our history with racial injustice, these are the types of effects that we're seeing. I think a lot of times when we talk about environmental injustice, we talk about intent, but we don't talk enough about outcomes. And I think this is an example where you would say, you know, did they intend to locate in a Black and brown neighborhood? To me, you know, I'd rather look at the outcome. And, you know, having folks live right next to hazardous waste facilities has a tremendous impact on not just health, tangible things like health, worker productivity and things of that nature. But one of the things that I like to bring up is it says to children what their value is in society when you have to think about and you have to live next to facilities like this. And I think that's a cost that we can never capture fully. Next slide, please. Another local example, so Marathon Refinery, which is the only refinery in the state of Michigan. It's located in Detroit's 48217 zip code. A lot of research, depending on who you ask, would cite that it's the most polluted in the state. Occupies over 250 acres, produces about 140,000 barrels of oil per day. It's connected to Enbridge Line 5, which brings, you know, the tar sands oil from Canada down, which is, you know, of course, has been controversial and been in the news a lot. But the impact on local community is also significant. And I mean, just last year during the polar vortex, there was a toxic odor release where you could smell, you know, past Detroit and Dearborn on the other side of Detroit, just the most foul smelling odors. And later that year in September, there was another release event where a couple of workers were sent to the hospital, and folks didn't even get notification of the event until about an hour after the release event. And so again, you're dealing with health impact, things like asthma, you know, having your asthma triggered. You're dealing with long-term health impact, things like cancer. But again, you're also dealing with things that oftentimes cannot be captured and cannot be measured. So the psychological impact of having alarms set off very frequently, multiple times a year. You know, when you see something on the news, a refinery fire or explosion. One example is Deer Park, Texas. I was in Texas at the time. And benzene, there was a lot of benzene that was going into the air from a refinery and from a toxic waste facility. When you see now those types of events, it makes you worry. What if the refinery, the only refinery in the state, suffered that same fate? And what would happen to the communities that are located right next and right under and right in the shadows of that facility? So that's something to think about, and that's another example I do want to point out. Next slide, please. AK Steel, another example of air quality in the area. It's located in Dearborn. This has been called by state regulators, we know, based on FOIA requests and conversations between state regulators, that it's by far the most egregious facility in the state, is the phrase that was used. It's, like I said, it's located in Dearborn, bordering Detroit, primarily an immigrant community. Facility is located next to two schools. Salina schools are located right next to this facility. The only thing that separates this facility, if you're familiar with the area, is a small road and a train depot. You can smell and see the facility working as you're playing during recess. And I do want to point out that this is a facility that has, you know, received tax breaks, has gotten off with slaps on the wrist as a result of clean air violations that have happened over and over again. This is a facility that has a history of violating sulfur dioxide pollution standards, manganese pollution standards, which has a significant impact on neurological development in children. Lead emissions had several problems with that. And this is a facility during the pandemic or prior to the pandemic was seeking to triple the levels of lead and manganese that they emitted into the environment. Again, right next to a school. And this was in January and February. There was a quieter campaign than normal, but there was a quiet campaign to try to get the company and to revoke and to remove their permit. Also efforts to get the state government to hold the company accountable and to say, you can't increase the levels of lead, manganese, and other chemicals, especially given your history. They actually withdrew the permit, their request, about 3 weeks ago. And so it's hard to celebrate things like that when they've had such a tremendous impact on the community for such a long time. But I think it does serve as an example of how COVID has changed the conversation about air quality, and has made the issue more urgent for people. The letter that we sent to EGLE, which is the Environment, Great Lakes, and Energy Department for the state of Michigan, argued, citing a number of studies that when air quality is bad, folks are suffering from COVID at increased rates. So people have pre-existing conditions, and that decreases their likelihood of surviving COVID. And so I think COVID, air quality and the examples that I just provided is certainly an urgent topic when you have companies from US Ecology, hazardous waste processing plant, to Marathon, the only refinery in the state, to a steel plant located right next to schools. So I think it's something to think about as we dive into discussing COVID and some of the underlying inequalities that are exacerbating the pandemic. And I will turn it over to Dr. Sampson for the next slide.
So just to share one more example, and you're probably seeing some patterns here of, land use, infrastructure, permit, zoning decisions that are not considering, are not looking at this history that Justin referenced, and taking an equity lens or thinking about the potential for environmental racism and what that means for communities. And so this is an example from Southwest Detroit, specifically the Delray neighborhood and surrounding community, that mobilized, again, a pattern of community mobilizing to advocate for research, for policy, and permitting decisions that address some of these health concerns. And so many of you might know about the Ambassador Bridge, and that currently about a mile or two down the road from that, down the river, a new bridge is being built. And so beginning over 15 years ago, some of those decisions started to play out, and it became pretty clear that that bridge was going to come to Delray, a community that was already experiencing many cumulative environmental impacts from some of these pollution sources that Justin just referenced. And so the residents organized, and they started doing truck surveys. They were starting to look at the routes that trucks were taking down residential streets. They were starting to do community surveys, which is how I was engaged with this group, the Community Benefits Coalition, to figure out and document what they knew they were experiencing, the health concerns that they knew people had, safety concerns, hearing, headaches, trying to document this data and this lived experience in a way that decision makers would listen to. And so actually presented this data to Governor Snyder's staff and office. And, one of the comments was, but how many people are smoking cigarettes? And so just, again, thinking about social determinants of health really being a driving factor that often gets overlooked in these decisions, and how that affects population health and community health. And so you can see on the right is a slide, an artist rendition of some of the literature around the health effects of living next to a commercial freeway. And so residents were responding to this in part of the survey, in understanding some of the health issues and talking through that, both with open-ended questions and asking some health questions, but really trying to capture this experience and communicate it to decision makers. And so, there's diesel, black carbon, particulate matter, ozone, a lot of our air quality standards under the Clean Air Act are measured. But when the environmental impact statement was conducted for this region, it was done regionally. So it said, actually, air quality is going to improve. Well, if you live in the neighborhood where a plaza is now going to be across the street from you, you might guess that your air quality may not improve, and your exposure to some of these things may not get better when there's thousands of trucks anticipated to go through these neighborhoods. And so the community really organized, and were successful in getting a $48 million city-state agreement that would end up funding an additional health impact assessment done with the community, additional air quality exposure monitoring, development of a neighborhood fund to support residents who might want to move from the area, and also a home mitigation fund that would help to deal with HVAC systems in people's homes and windows to make sure that they were sealed, because indoor air quality is also an issue. So while it's an amazing outcome and it really reflects years of community organizing and thousands of meetings, it really also recognizes that this burden to protect the social determinants of health is really placed once again on community. And so just kind of bringing home some of those points are time and time again an experience that plays out. So transition to layer COVID on top of environmental justice. So this is a powerful quote that we talked about actually in preparing these slides. There were many different media articles, epidemiologists, organizers who are talking about this idea that COVID is really shedding light on inequities that we know have been there for a very long time. And so this quote is from Dr. Barber, who is actually a daughter of Reverend Dr. William Barber, who is a civil rights activist of the Poor People's Campaign and advocating on issues of health and justice regarding COVID. And so his daughter is an epidemiologist at Drexel, and so this is in reference to Philadelphia, but you could think about other communities experiencing this. The compounded effect of racism is really showing up in the interlocking systems of structural inequality operating in this moment to increase exposure, transmission, severity, and the likelihood of death from COVID-19 in communities. She gives the example of Grays Ferry, which have already experienced such devastating environmental racism for so many years. So just thinking about what this means for COVID cases, hospitalizations, deaths. You've probably talked about in this series, or if you've watched the news, you've seen the data. Some folks are really tracking it closely, and I almost hate to reshare it because I think, especially for folks whose communities have been hit the hardest, this is kind of reiterating it over and over again that we have these patterns. But as Justin said, we need to talk about these outcomes, and we need to talk about why they're playing out this way. And so between January and August 10th, there were 5 million cases of COVID in the United States. As of August 18th, there are 170,000 deaths. So this third set of numbers that you see there, 46%, 30%, 14%, are the rate of, so there was a study looking at children who had been hospitalized from COVID. So nearly 600 children in the United States, as a reminder that yes, kids can contract COVID and have serious health implications from it. But the 46% of those children identified as Hispanic, 30% as Black, and 14% as white, which is not in proportion with the demographics of the United States. And so we see some stark patterns, some stark disparities there. And then we can look at this table from the CDC. Again, when we look across groups, those numbers that stick out to me, American Indian and Alaska Natives compared to white Americans, white residents is 5.3 times higher likely to be hospitalized. And then for Black and Hispanic, 4.7, 4.6. So what's going on? Why is this happening? We need to address it. And environmental justice and racism is a piece of this story. So I'm going to kick it back to Justin to talk about these layers.
Yeah, thank you. So, video. There we go. Yeah, so there are a lot of layers that intersect environmental justice and COVID. I think the first one I want to talk about is COVID and water. And I will just start off by playing a video, and then I'll come back in if you could start the video.
You can call it a water war. The city of Detroit started shutting off water to thousands of people for lack of payment.
Yeah, pretty unbelievable, right? Now activist groups and experts from the United Nations are getting involved.
My name is Reverend Ross Bouye. This is the Brightmoor Connection Food Pantry that we're standing inside of. We are in the community of Brightmoor, which is in the northwest section of Detroit. Brightmoor has a unique reputation of having the highest population of water shutoffs. Brightmoor also has the highest population of infant mortality deaths in the womb and out of the womb due to water shutoffs. This is something that should have been addressed over 6 years ago. This has been ongoing. This is not anything new. This was the perfect recipe for a pandemic.
The number one thing that folks can do to protect against the coronavirus is wash their hands. But it's really hard to do that when folks don't have water. So groups like We the People Detroit have been delivering bottled water to families that have been shut off. This should not be the case. We're a state that's responsible for so much of the world's fresh water. We're also the state responsible for Flint. And so if there was a time to make sure that people have access to clean water, this is the time. Thank you for playing the video. So I do want to touch on the connection between water shutoffs and COVID, as you heard in the video. There's a study done from the Michigan State University that showed that the number of Americans who will be unable to afford their water bills could reach 35% by 2022. And this is triple what it was last year, just in 2019. So just think about having that large of the US population unable to pay their water bills in just 2 years. I think there are a lot of reasons for this. You know, federal and state disinvestment in water infrastructure has increased the cost of maintaining water systems throughout the country. That disinvestment and the rising cost of water, that cost has been passed on to consumers, to people. At the same time, we have companies and other folks who bottle water who are able to get water essentially for free. Nestle is an example of that. And I think it is pointing to what we've been discussing earlier about just layers of inequality, how it intersects with race, intersects with income, intersects with a lot of other systems in history. There was new research that recently came out from the ACLU that showed disproportionate impact of water shutoffs on communities of color. So according to this data collected locally, over the past 10 years, Detroit areas with populations less than 75% Black had on average 60% fewer water shutoffs. The vast majority of water shutoffs have been concentrated in minority communities and poor communities, as you would expect. And this gets to insecurity that is concerning from a public health standpoint when it comes to COVID. The video said, how can you wash your hands if you don't have water? And that has been something that advocates and researchers have been, chanting and screaming at the top of their lungs for a long time. For a long time, there was a hepatitis outbreak, and people and researchers connected the dots between water shutoffs and hepatitis. And for a long time, people were sending letters, petitions to those in power to say that we need to act on water shutoffs, not just because people should have water, which is the humane thing to do, but also from a public health standpoint, it makes all of us more vulnerable to disease when people don't have access to the sanitation that they need, which is water. And so I just want to say that has been a fight going on for years and years and years and decades. There was a moratorium put in place by Governor Whitmer, a statewide moratorium on water shutoffs, which was a huge thing for folks who have been fighting for such a long time. That moratorium on water shutoffs, it ends at the end of the year. And so we're thinking right now, what are the long-term strategies, long-term investments that need to be made to make sure that everyone has water from a humanitarian, from a human rights perspective, but also from a public health perspective. And I think that it's extremely important, even more important now that we're facing COVID as well. Do you go next slide for me? So when you talk to environmental justice advocates, we'll typically talk about water, air, and land. So talked about water, air quality is another big concern. I don't know how big the slide is on your screen, but I will just say that this slide is meant to just convey to you that there has been a lot of research done recently connecting the dots between pollution, high levels of air pollution, and people living in those communities are more likely to die from COVID than people who live in less polluted areas. And this is because of the particulate matter that people are exposed to, the pre-existing conditions that people have, like asthma and other respiratory issues that are risk factors, when in contracting COVID. This also just points to, as you would expect, the types of communities that are have been disinvested in, that don't have resources for, reliable transportation, food, the other things that you need to survive in a time where we're all going virtual. Those communities, as you would expect, are ones that have lower rates of health insurance, have lower rates of other things that you need to survive. But the links between air quality and COVID are clear. The graph on the right, if you can see, it's stratified by type of air pollutant. The orange part of the graph represents the number of studies that reported a statistically significant positive association between air pollution and COVID. And it's broken down between long-term studies and short-term studies. 27 out of 28 of the reported studies showed evidence that there was a significant statistical link between air pollution and COVID health outcomes. And 11 out of 12 of these were long-term studies, and all 16 of short-term studies reported this statistic significance. And again, that just goes back to the pre-existing conditions people have and other factors that impact health as a result of air pollution. Next slide for me, please. Like I mentioned, air, water, and land. So toxic waste is another layer that's important to keep on top of this. Like I mentioned, in talking about U.S. ecology, there are significant health outcomes when it comes to being located next to a toxic site. But also one thing to think about is the types of materials that are finding their ways in a certain community. So PPE that is not safe, that's been used. The occupational hazards that certain low-wage workers are being exposed to, waste and garbage pickup, and even outside of toxic waste, just the fact that low-wage workers are being exposed to more people and dangerous situations. But there are also links between COVID and the waste that people have in their neighborhood, the sewage that some neighborhoods are exposed to, that I think are important. And next slide for me, please. So just to sum up this section, we're seeing with COVID disparities along racial lines, along economic lines, and these racial health disparities really reveal old and new layers of inequality that are building on one another. When it comes to environmental justice, state pollution permitting continues. It was fortunate that the company AK Steel pulled back their permit, but they are one exception to a rule, which is that when companies apply to expand operation to pollute more, especially in environmental justice communities, they have that leeway. And this is in the southeast part of the state, northern part of the state, western part of the state. On the federal level, we're also saying, and to the right, you see just it was hard to include all of the stories about EPA rollbacks. But the Trump administration has cut over 100 environmental regulations, and that's had a significant impact on people's ability to live a decent life and a healthy life. So I will just leave it there and go to the next slide.
Sorry, I was trying to get back to our full screen mode here. I'm not sure if I can, but that's okay. I'll talk through it. If it's too small, we can share slides later. So how do we respond to this, right? If we know that social determinants of health are so important, why doesn't public health do a better job of addressing them? Why do we focus on these behavioral factors? And there's many reasons, I think, and I want to talk through some of the challenges, both from regulatory science piece. So the science that goes into informing the Clean Air Act, for example, and how permitting happens, but also just the enterprise of scholarship in science and how that doesn't always get us where we need to be. So there's a lot of reasons. One of the issues we're seeing right now is that public health is largely underfunded. Our local public health departments are reacting and responding to COVID. And I think that just doing amazing work, but they're tired and they're unable to deal with some of these other kind of ongoing issues. And so just thinking about, if we look at the dollars spent per person on medical treatment versus public health, this is always an argument we make to show that, you know, we can prevent a lot of these things. And so that's one reason. When we talked about all of those examples, I want you to think about what other sectors are implicated, what other fields. So transportation planners, for instance, or people who develop housing policy and development of communities, who make zoning decisions. They may not be trained in public health. They may not be trained in environmental justice or work with environmental justice leaders to learn about how their decisions have these major impacts. And that's not an excuse, but something that we need to work on. And so just thinking about public health's role in doing this work and this research, I've been to a lot of community meetings where I've heard people say, we don't know that X causes Y, or there's a lot going on. There's a lot of cumulative exposures happening. We can't say that it's the diesel, or we can't say that it's the PCBs or the mercury in the air that's leading to cancer in this community. And so the tools of public health can be really powerful, the research tools, but these studies take, really rigorous studies can take decades. And our way of thinking about translating that into action can take even longer. And so I think, you know, there's this concept of precautionary principle in making policies based on enough information, listening to communities to know that there's things we could be doing now to prevent these health issues without having, you know, really rigorous experimental studies done on a community. And so I think that it's really hard to show things with our traditional toolkit in terms of disease clusters or some of these concerns that communities have. And so, you know, another factor being that if I'm exposed to something in utero and I don't have a health outcome that shows up until I'm 60, it's really hard with our toolkit in public health to make the case that X caused Y, right? There's powerful work happening in epigenetics, but there's a lot of reasons why that research slows down the policymaking process that can be harmful, I think, in these discussions. We've mentioned this before, but the burden of proof continues to fall on frontline communities. So oftentimes that mobilization leads to data collection, either by the community with academic partners, which then can motivate some of that policy change. And so I think that is a real thing that is expected, you know, a decade of organizing and then coming up with the data to prove when most people can see quite clearly, you know, some of these pollutants you can see in the air. So just kind of thinking about, why does it work that way? This is something that actually Justin and I have talked about quite a bit, is, you know, data is really useful. It's really helpful to show these patterns. It's really helpful to show how harm is inflicted in terms of respiratory outcomes or other outcomes. But, you know, in research, we have a lot of excitement about big data and data science and look at all we can figure out with this from a, you know, add to the literature. But oftentimes we don't value different types of data, or again, we're not moving fast enough with the data that we do have to be precautionary. So I think we have to be really thoughtful about, especially in academia, where the incentive is to get the next grant and to publish the next paper, is that really addressing these concerns? If the goal is really public health, are we really getting there? And then for any of you who've looked at how the regulatory framework works in terms of the Clean Air Act, or in terms of TSCA, for instance, which is our toxins policy, we really, in the United States, specifically with TSCA, have this framework of, you know, we have 80,000 chemicals or more that are manufactured or brought into the United States, and really they're kind of put on market until we can prove that they're harmful, which is pretty backwards thinking, right? So if we're thinking about who's at risk, which is this framework we use a lot in terms of determining standards for what's safe and what's not, this risk management idea is really problematic in that we're often not considering the impacts on specific populations. For instance, there's been research done on pregnant women suggesting that the clean air standards for particulate matter in ozone, we might want to consider something lower to protect specific vulnerable populations, but we kind of keep it at this higher level that's the general population. And so this idea that we need research studies to show that someone's been harmed before we can create a better policy is really troubling and perpetuates some of these inequities. And then I also wanted to bring up this issue of victim blaming. So I mentioned the cigarette example and this idea of lifestyle choices, but this is, if it works, this infographic from the CDC that corresponds with the data we showed you earlier about the health disparities, the health inequities that are playing out. And I want to show you, there's a reference to some of these social determinants of health in the sentence above the table that references, socioeconomic status, access to healthcare, the fact that certain occupations are more vulnerable. But really the key message here is these behavioral factors, which, really suggests that if you just do these things, you won't get sick. Well, we know that there's people who are working on the front lines that are, they might be doing these things, but are at a greater risk. And so I think we have to really be thoughtful about how we communicate some of these patterns and the narrative that goes with them, because I think that we're actually doing quite a bit of harm in the field of public health sometimes. On the flip side, I think that it's an exciting time to be in public health, obviously, and that there's a lot of leaders, thought leaders, activists, scholars who are doing amazing work in trying to push and rethink this policymaking process with communities, listening to communities, led by communities. And so there was actually a report that just came out of all former EPA staff, signed by all past administrators except for the most recent administrator, about resetting the course at EPA and really questioning some of the regulatory framework, questioning EJ work and what needs to happen and making suggestions to that end. I think there's a lot of great models within public health emerging. So things like health impact assessments that really capture not just a single pollutant and how it affects an individual, but look at holistically the experience of a community that's quality of life is impacted by a land use decision. So a health impact assessment is meant to kind of think about multiple health outcomes, not just one chemical and one health outcome that we know is not enough to tell the full story. So this is a quote from Hopkins: "Learning when to lead and when to listen." I think public health struggles with this as experts, trying to figure out when they're working with communities, when they're of a community, there's different types of expertise. And I think coming together most effectively means listening sometimes and not coming in to solve anyone's problems, but listen to solutions that are already on the table. There's also just amazing work happening among scientists, specifically among some of younger scientists coming in how to translate research into action better. There's a group called Agents of Change out of George Washington University that's been just really talking about how to do public scholarship and public writing and diversifying the workforce that are environmental health scientists. And I think that I'm really hopeful about the future of this work and being able to advocate on some of these issues. There's a lot of work being done on local government. So where there's maybe federal rollbacks or state permitting isn't addressing cumulative risks and impacts for communities. Are there zoning decisions? Are there local ordinances, such as the Pet Coke ordinance in Detroit, that can start to address some of these issues? Again, thinking about other sectors, there's a framework for thinking about health in all policies. So some communities are starting to think about, when we have these cross-sector decisions, is health on the table? Are we talking about population health? Are we talking about environmental health? And then finally, cities are declaring racism a public health crisis. So across the country, we've seen this, local health departments, state health departments. The question is, will there be action tied to this statement? And I think that's a really important question to ask, and to hold our field of public health accountable in doing that work.
Thank you for that. So I do want to spend a quick second talking about how communities and how organizers and researchers have responded, and what are the tools available to us to create change and try to move the needle in the right direction. The pictures you see are just from organizer meetings, town halls that have been held. A lot of these happen on the tail end of crises. So after a crisis hits and people need answers and want answers, getting state regulators and city officials in the same room to be able to ask questions is something that environmental justice advocates are facing a lot. So marches, hearings, meetings with regulators, these are all tools that we use to try to get people to think about environmental justice, and not just to think about it, but to act on it. One of the models that I like that a mentor of mine uses as an organizing model is agitate, advocate, negotiate. So agitate, making sure that the issue is front and center in people's minds, that it's a high enough priority to where people and public officials and other decision makers will be called to act. If something bad happens but no one knows about it, people are able to turn the other way. So agitating is about making sure that public officials and decision makers have to act, have to respond, even if it's to put out a statement, even if they're spin, they're called to action because there's been agitation. Advocate, so it's not just agitating, and it's not just getting the profile of the issue raised, but it's advocating for very specific policy goals. A lot of times you will see in social justice movement work that people are agitating, but there's not that second gear with policy demands that people are forced to respond to. And so what happens a lot of time, without agitation, you don't get people to the table, but without advocating, without very specific, well-researched, and this is where researchers and academics can come in, without that well-researched, those policy goals and demands, it allows folks in positions of influence to, what's the right word, to sugarcoat, to greenwash, to declare victory on something that it wasn't a victory. So coming to the table with very specific policy goals and demands is really important. So that's advocating. And then negotiating. Once you're at the table with someone, knowing what's acceptable, knowing what would move the needle and what would not. I've worked with community residents across from some of the largest industries in the area. And one of the questions that executive for the company asks is basically, what would make you all happy? What would make you satisfied? And they asked that question kind of in a snarky manner because they were frustrated that we were making them look bad. But knowing what the goal is and knowing when to walk away, when something is acceptable, when something is not, when you can come to an agreement on something and then build on it later, I think that's really important. So agitate, advocate, negotiate is a model, that I try to abide by in my organizing work, with the end goal being policy change. Next slide, please. And lastly, I do want to mention some of the challenges, and this was mentioned briefly, some of the challenges and opportunities in organizing for environmental justice. The first is that, before we can get into discussions about which peer-reviewed research we're looking at, or which specific facilities we're talking about, I think conceptually there needs to be a shift from communities having to prove that they've been harmed to industry, to actors that common sense will tell you isn't great to live next to, proving that that is safe. One of the first meetings I went to as an organizer for the Sierra Club was a community air monitoring meeting held by a local community resident, Dr. Dolores Leonard. She's an educator by training, but also an environmental justice advocate. She, along with Teresa Landrum and a number of other community residents, were able to secure an air monitoring station from the state of Michigan that cost hundreds of thousands of dollars. They were able to do this because of years and years of work, years and years of advocacy. But that air monitoring station, they were constantly having to pull the data, analyze the data. I mean, they honestly deserve honorary doctorate degrees for the level of sophistication and work that has been done over the years. But you know, the data at the various meetings that were held to state regulators was oftentimes dismissed, or you have community residents saying their home property values have dropped precipitously because of a new industrial facility that's moved in the neighborhood. You have community residents saying that it's hard to find someone on the street that hasn't been impacted by cancer or asthma because of the industry. You have community residents talking about the sirens and the smells that have just become normal. But on the other end of the table, you have folks who aren't compelled or who don't think it's significant enough to act because they are looking for very specific data. And I think just conceptually shifting the burden of proof off of community is something that's a challenge and something that's also an opportunity. Cumulative impact was mentioned. The way we regulate air pollution now, we look at company A, we say you are under the limit, you can pollute. Company B, you are under the limit, you can pollute. But we don't look at the impact on the community of having company 1, 2, 3, dozens of companies located and concentrated in an area. And so not just measuring, but regulating based on that cumulative impact is extremely important, is one of the top priorities of environmental justice advocates. The last two things I'll mention is changing the way we hold people accountable. Right now, when companies are fined, that fine money, which people, myself included, would say is most of the time it's not significant enough to dissuade people from making the investments to not pollute. When companies do get fined, which is rare, that money goes to the general fund, or the state spends it on other priorities. That money does not go back to the communities where people were harmed, and that's one of the things that legislators at the state level are working to change, but that is a top priority. And then the last thing I'll mention as just both a challenge and an opportunity is the importance of building solidarity across communities. It's important to balance the racial disparities, the economic disparities that we see when it comes to public health and environmental exposure, but also recognizing the need to build political capital and political power. It takes building solidarity across communities. So one of the questions that I ask and other organizers ask is, how can we connect the struggles of people in Oscoda, Michigan, who are dealing with contaminated water from PFAS? How can we connect those struggles to people who are living right next to the only refinery in the state? How can we connect people who were driving through, you probably saw in the news, green ooze flowing on the freeways in Sterling Heights because of a facility that was allowed to operate recklessly for such a long time? How can we connect those struggles with people in Dearborn who live right next to a steel mill that's constantly violating clean air standards? So the importance of building solidarity, it's not just a wishful thinking. It's important. It's not just a wishful dream as an advocate. It's something that's necessary, I believe, for building political capital. And I think that's a challenge, and it's also an opportunity. So I'll leave it there, and Dr. Sampson, I think you have the next slide.
Yeah, so I hope we've made the case that a return to normal is unacceptable as we talk about this new normal in living with COVID. I'll just leave it there. And we actually came up with a few questions for each other. I want to make sure that we have time to also answer any questions that are emerging. So we're going to kind of move it into a bit of a dialogue, but Dr. Finley, if you want to interrupt us at any point and throw some other questions at us, maybe we'll start with a few here and make sure we get some audience ones in.
Sounds great, thank you.
So Justin, this first one's a biggie, but I'm going to throw it at you. you've had time, I think, to think about this. So many have articulated that movements for environmental justice, climate justice, education justice, racial justice, and criminal justice reform are deeply intertwined. In his article titled "Racism is Killing the Planet," Hop Hopkins of Sierra Club says, it's all part of the same story of dehumanization. What does this mean for the solutions we must seek?
Yeah, that's a difficult question. I think the first thing that I would say is acknowledging that I agree with that statement. You know, when you have an education system that is deeply, deeply flawed when it comes to how it's funded, where, you know, depending on the amount of property taxes your school system receives, you get a better education or a worse education, and that how that inequality compounds over time and over generations. When you think about, you know, who is allowed, which companies and which industries are allowed to locate in which neighborhoods, that goes to how people are valued or devalued. You know, when it comes to criminal justice, which lives are valued when officers take a little bit more time to try to understand who they're stopping, to try to understand and see humanity in the people they're stopping, and which people don't get that benefit of the doubt. It speaks to how people are devalued or valued. So I do want to acknowledge that I agree with the statement that it comes down to the basic fact that certain lives are devalued and dehumanized. I think in terms of solutions, we have to acknowledge that. And I also think we just have to be upfront about it in every aspect of policy making. The other thing that I'll mention is that when we talk about inequality, a lot of times it leads to this, oftentimes, you know, how can we, which is coming from a good place, how can we help? How can we change this? I think what's not talked enough about is there is a significant cost to inequality, to injustice, whether it be, you know, you could capture that in monetary terms, cost to our education system and economy when when a significant portion of populations don't get adequate resources. So I think we just need to have a more holistic conversation about what the cost of inequality is. And I'm hoping that that's a good starting point.
So actually a question came in that relates a little bit to this, or maybe is a counterpart to this that I might offer. So it's this. I am all for improving living conditions for all of our residents. It seems like this will involve a lot of money and resources in addition to significant policy changes. Have you seen any cities or regions that have effectively gotten access to these resources? How did that happen? And I guess I would add, and the way I would connect this to our previous question was, you know, can you talk a little bit about the offset there, right? The investment in some of these pieces to bring inequality for residents, you know, offsetting the costs or the opportunity cost, I guess you will, of not providing a high quality education, of having public health available to residents, et cetera.
Right. I love talking about this because, you know, when it comes to climate change, this conversation is really big. Are we going to pay for all of this? And every plan, whether it's a lot of money or not, starts out with $2 trillion or $10 trillion. It's always the headline, which catches people. But in terms of climate change, what's not talked about enough is what the cost of doing nothing is. You know, for me personally, I experienced 3 500-year storms in 5 years when I was living in Houston. $125 billion was the amount of money it cost for Hurricane Harvey. If you are experiencing that every year and wildfires, that's a significant cost to the economy. So just the first point I would make is those costs are already here. It's just a matter of investing early. I think practically, to answer your question, some examples of cities and states who are doing a good job when it comes to environmental justice. Fulton County, Georgia is an example of a county that's legislating on environmental justice, doing great things. San Francisco, a lot of other cities in California have things like environmental justice review process. There's some cities in New Jersey, Camden, and Newark, I believe, that have a number of zoning and review process and investments that are going to environmental justice communities. A lot of this has been, taxes that are levied on companies that are, high polluting facilities. One of the concerns that people have is when you start to raise taxes on companies that are fracking or, poisoning well water and other things, will they leave? I think, there's a study I can't recite off the top of my head, but companies locate in areas where people are educated, where the infrastructure is good, where people are healthy and productive. And that drives a lot of the decision making in terms of where companies locate, more so than taxes a lot of times. So I think there definitely needs to be a balance, but I think, having companies that are contributing to the cost that communities are experiencing pay for some of the externalities is a good starting point.
Thank you.
And I wanted to ask Dr. Sampson a question, just as someone who is community oriented, who does research. What do you see, and you can answer this for your work specifically or just broader, what do you see as the role of folks who are in academia in fighting for environmental justice? What are the challenges and opportunities as someone who does research and who also wants to see policy changed?
Yes, who also wants to see policy change. I'll emphasize that. Yeah, I mean, I think that academia can be part of the problem or part of the solution. And I think that, I've seen many great partnerships that are, communities and academics working together to identify what are the research questions, what are the methods, what is the goal of a study, what is, how do we make sure this doesn't just get published in a paper, which is important in many ways, but also put into plain language and shared with decision makers. I think oftentimes we assume that decision makers are experts on things when oftentimes their training may have nothing to do with public health or environmental decision making. They might, have come into that role through some other pathway. So, I think most training in research doesn't look like that. It doesn't, there's methods called community-based participatory research, participatory action research. There's citizen science, which some people call community science. Thinking about more community-led research of, taking that back, especially as technology becomes more accessible. People can collect data on their own air quality if they have access to it's getting affordable to be able to do some of this stuff, or community organizations are able to do some of this stuff. And so, I've been lucky enough to have some really great academic, community, folks in government agencies, mentors who have shown and modeled ways of doing this, right? There's a lot of different tools that researchers can work with communities to develop principles of environmental justice or MOUs to work together. I think to talk about these things up front and to talk about how to deal with conflict. But I think a lot of researchers have to unlearn some of their training to be able to do things in a way that really centers community. And also just our incentive structure in academia is pretty problematic. It's about papers and grants and, in higher education in general. And I think that some of the work that academics do that might be writing an op-ed or working with a community partner to put together some sort of report or media product aren't always valued. And so I think that having some of those conversations is important to addressing some of these issues. I'd also say, as academics, we teach. And so I think that thinking about how our students understand these intersecting issues is really important to me. Whatever sector or whatever path my students are on, recognizing and helping them understand that they're going to make decisions that impact public health. I would argue that till my last day on earth, that whatever, if you're going into engineering or education, and so thinking about these issues is really important. Also recognizing, some of the students in my class are experiencing some of these issues. And so thinking about how we teach and talk about these issues in a way that doesn't re-traumatize people or allows them to heal if they're dealing with some of these health inequities and environmental justice issues, and helping figure out what role they want to play, whether this is new information to them, whether this is their lived experience, and really, you know, a big responsibility, I think, in the classroom, and thinking about how we talk about these issues and bring them up. So yeah, it's always on my mind on how to do that better, and I haven't perfected any of that, but I think there's opportunity, and I think that academia is moving in the right direction of doing this, but there's a long history of exploitation in the field of research that that is kind of in the background of all of this.
I do love that answer, and I personally really value the work of, you know, we work with a lot of lawyers and researchers and professors who are able to go into, you know, advocacy meetings with city councilors and to be able to say, you know, I am someone who has studied this for decades. I know what I'm talking about. And, you know, advocates have a point when they're advocating for this specific policy, you know, adds a lot of weight to what people are advocating for. So I am appreciative of the work that professors and researchers are doing when it's coupled with community action.
So you both have referenced policy level changes that people can advocate for. Do you think that the solutions to most environmental justice issues are at the policy level, or are there other areas where you think there might be opportunities to be equally impactful?
I think both are important. For me personally, I think they're, you know, talking a lot about climate change and environmental justice. I think most things have to be addressed at a systematic level. I do think as we're advocating, you know, for lower emissions and things of that nature, that we need to impact people's lives on a day-to-day level. You know, if your water is shut off, it is fine for someone to advocate for your water to get back on, but it also is great for someone to give you water temporarily until you get it shut back on. If you have poor air quality in your neighborhood, it's great for people to advocate for, you know, Marathon or other companies to reduce emissions, but it would also be great to have an air filtration system in your home so your air quality is getting better. So I don't want to say they're equally important, because I think policy change is how we ultimately impact people's lives in the long term, but that short term, immediate impacting people's day-to-day lives is also really important, and that happens, you know, through philanthropy and through grants and other means that aren't connected to policy.
So we're running pretty short on time here, so I just want to offer up one more question. What types of structural inequalities do you think in particular are contributing the most to the spread of COVID-19 in communities of color or in low-income areas?
Yeah, we alluded to that throughout, but Justin, I'll let you take that and I can jump in and add if you want, but go for it.
Yeah, I mean, when it comes to air quality, I think the piece about pre-existing health conditions for people living in polluted areas is huge. Outside of air pollution, I think the types of jobs that people are having to work, you know, people having to take public transportation because they don't have access to personal transportation and they're being exposed to other people. I think so. Economic issues around, you know, what jobs, where the jobs are, has a huge impact. I also think one of the interesting things that I have heard is thinking about how often do you have to go out for food and for other supplies. If you have the money to buy things 2, 3, 4 weeks at a time, probably limiting exposure compared to someone who doesn't have the income to buy those things in bulk at that scale. So I think just on every single level, in every way, and education, you know, who has access to computers and reliable internet and a quiet place to study. So I think when it comes to COVID, we're seeing across the board a lot of drivers. So it would be hard to point out one in particular. But Dr. Sampson, any thoughts on that?
I think you captured all of that I would say. So again, I know we keep coming back to this idea of social determinants of health, but just thinking about, yeah, I think all of those issues, going back and looking at them compounding on top of one another. And then again, bringing it back to policy. So I think that, you know, as policies are being drafted in response to COVID, whether they be economic policies, vaccine, figuring out who gets a vaccine when, right? Thinking about all of these with an equity lens, you know, is really important. And so kind of bringing that up and bringing that to the forefront again and again and again, I think is really important.
Okay. Well, thank you so much to both of you for that wonderful presentation and for some really thoughtful answers to some pretty difficult questions. That concludes the formal part of tonight's presentation. I do want to mention a few quick things as we close out. So as has been the case throughout, all of our presentations will be recorded, or is being recorded, I should say, and soon will be uploaded to our Pandemics Perspectives website, which should be available tomorrow. We also wanted to let you know, for students participating in the course, there is an issue with the Canvas site right now. So I've recently sent you a message in Canvas with 5 quiz questions for tonight. You can do one of 2 things. You can either respond via Canvas message to me with your answers to the 5 quiz questions, or you may email pandemicperspectives@umich.edu. And finally, for your final reflection, which is a required part of the course, you can do the same thing with that. You may either email it to pandemicperspectives@umich.edu, or you may send it via Canvas message to me directly. If you have any questions about anything that I've just shared, please don't hesitate to reach out via email or via your Canvas messaging. On behalf of the University of Michigan-Dearborn, we are closing out tonight, our last time together. I do want to sincerely thank you for joining us and being a part of this phenomenal, interesting, and new learning experience. We were so glad that you're here. Take care of yourself and stay safe. Good night.